Hi, my name is Catherine. I'm going to be your nurse today. Before we get started, can I have your name and date of birth? My name is Joanna Smith. My date of birth is 5/19/1984. Great. Okay, so today we're going to be doing a quick assessment and then I'm going to go over some health teachings with you. Thanks, Miss Smith. All right, can you tell me where you are and why you're here? I'm at Tampa General Hospital because I had a stroke. Good. And what month and what year is it? It's March 21st, 2021. Perfect. And who's the President of the United States? The President of the United States is Joe Biden. Awesome. Okay, so can you look at me right on my nose, and I'm just going to look into your eyes with my light and try to keep your eyes open if you can. Okay, great. So now I'm just going to check your ability to follow my finger. So if you can just follow my finger with your eyes. Perfect. Okay, I have a couple questions. So you just had a stroke. Is there anyone at home who can help you get around? Is there anyone who's going to be able to check up on you frequently? Just because we want to make sure that if something happens again, that you have someone to help you. Yes, I live with my husband, so he can check up on me, and also my sister's very close to me, so she's probably gonna be stopping by to help me as well. Okay, and if that changes, just let me know because I can get you in touch with a social worker or someone who can definitely find resources for you to make your transition easier. Okay, and now I'm just gonna feel either side of your face and just let me know if it feels different, okay? It feels the same on both sides. Okay, perfect. Next, I'm gonna check your ability to grab my hands with both of your hands, so pull me towards you and then push me away. Okay. All right, and now I'm gonna check your feet the same way. So lift your feet up, put them back down, press on the gas pedal, and then move your feet towards your face. Okay, perfect. All right, so there's a couple medications that the doctor has you started on. One of them is a blood thinner called Xarelto, and you just want to be very careful when you're taking it because it can make it a lot easier for you to bleed. So make sure while you're on this medication that you contact a medical professional if you fall or if you feel really dizzy when you get up, things like that, because falling and hurting yourself can be a lot worse when you're on a blood thinner. Does that make sense? All right. And then something else to remember while you're on this medicine is that you can bruise a lot easier and you can develop internal bleeding. So you want to be a lot more careful if you're riding a bicycle or if you're playing contact sports. Just make sure you keep that in mind, and if you feel like you hit yourself really hard, you want to reach out to someone and let them know, and definitely have someone monitor you just so that you don't develop something worse and have to come back. Okay, that makes sense. Okay, and you want to use a safety razor while you're on this medication because if you nick yourself, you can bleed for a long time. Okay, does that make sense? All right, good to know. Okay, I'm going to listen to your heart now, and I'm going to listen to your lungs afterwards, okay? Okay, I'm gonna listen to your bowel sounds now, just to make sure the pain medications that you're on right now aren't decreasing the gastric emptying in your stomach. All right, good. Next, I'm gonna feel the pulses in your wrists, and I'm just going to feel along your arms to see if there's any edema or swelling. Okay, perfect. I'm going to just feel down your legs really quickly, just to see if there's any edema, swelling. And then I'm also going to feel the pulses in the back of your feet and on the top of your feet. And if you feel like there's any decrease in sensation or tingling or numbness on either side, please let me know, okay? Okay, and do you have any questions for me? Is there anything I missed or something that you feel like maybe you didn't understand before or want clarification on? I do feel a little tingling on my left arm and my left leg. Is that gonna go away? Weakness you're having right now, it can get better, but the earlier the intervention, the quicker it will happen. So you definitely want to be getting up, moving around, and just trying to exercise those muscles on the left side of your body as much as you can. At the same time, though, take it in strides. So don't try to overwhelm yourself, but you want to be taking the opportunities that we give you while you're in the hospital to learn all the exercises and work on them so you really understand how to do them when you get home. Okay, I'll make sure that I work with them when they come by. Are you in any pain right now? And if you are in any pain, how would you rate it on a scale of 0 to 10, 0 being no pain at all and 10 being the worst pain of your life? No real pain, just the tingling. I don't have any questions right now, but you're right, it is a lot of information, so I would really appreciate some writing material so that I can just kind of learn about it on my own time, and then if I have any questions, reach out to my doctor. Of course, I can definitely get you that information, and if there's anything you think of, please let me know, and I can find that information for you, or you can speak to the doctors, or we can definitely find a way to get it to you. Thank you so much. You've been really, really helpful. All right, and then definitely press the call aid if you need anything, okay? All right, it was great talking to you. I'll be back in about an hour to check on you, and we can go from there. Okay, great. I'll see you in an hour.